Hi, I'm Teresa. I'm an aesthetic nurse practitioner and prescriber here at Premier Laser and Skin Clinics across London. So the things that you should know before coming in for your first time for Botox, or even if it's not your first time, is do a bit of homework and check your practitioner's experience, skills. Ask them, don't be shy. It's important to know where they were trained and if they're confident to provide the treatment and deal with possible complications. Other thing is to ensure the products and ask the products that the practitioner is using. For instance, here at Premier Laser and Skin Clinic, we only use Botox, which is a brand of the botulinum toxin A. There are other brands in the market, but this one is the one that has less reported side effects and complication rates. You should tell your practitioner, for example, if you are on any medications like anticoagulants or blood thinners, or if you have any sort of muscular disorder, you need to tell your practitioner, because it's important during the consultation for the practitioner to be aware of any complications that may arise. Any past surgery, as they could be involved and in the treatment, or may impair the treatment or their effect. So how do you prepare for your consultation? So ideally we'll be asking you to come makeup free, if that's possible. If not, we can take your makeup on the day. We'll be assessing your muscular activity, like raising your eyebrows, frowning, and giving a big smile to show the crow's feet lines, for example, or even in cases where the masseter is to be injected, like the jaw muscle, we would be asking for that to be clenched so we can have a look at the muscular activity on that precise moment. Avoid drinking alcohol the day before, as that can increase the risk of bruising. So that advice goes before having Botox and after having Botox. So after your consultation, you should avoid strenuous exercises. You shouldn't be lying down flat 4 hours after your procedure. Just use a big pillow to put behind your head. You should avoid saunas, steam rooms. So how the Botox works? So the Botox works by relaxing the muscular activity. Common places to have Botox is the forehead. There's two muscles here that come in a V shape called the frontalis. This is considered one area. The other area is the glabella, which is the frowning. The frowning happens because there are three groups of muscles. On the side, two corrugators. So if you imagine an angry emoji, that would be your corrugators. And the procerus muscles that comes across in the central. So this is considered one area too. Other area, still in the face, it is the crow's feet. So when we smile and you can see wrinkles that come out of your bone, that is the crow's feet. And the responsible muscle here is the orbicularis oculi. We call it OO for short. Other area, but it's not for wrinkles, is to relax, is the masseter muscle, which is around this area here. Some people refer it as a jaw muscle. What it does, for people that suffer with teeth grinding, or they're clenching their jaw all the time, or if they look for a slimmer face, because when they clench we can see the muscle coming out, that is a good treatment to have Botox. So we'll be administering some units in each side of that muscle to relax it. Therefore you'll be grinding less or not clenching as much. Smoker lines, which are caused by smoking, kissing, or even aging. You don't have to be a smoker to have those lines. And basically when you purse your lips and there's lines coming up, or when you're relaxing, we can smooth those lines out with Botox. So the other area we do is, as known, the Gummy Smile. So when you give your smile away and there's visible gums, and we call it the Gummy Smile. So by tightening a specific muscle, we can release that muscle, so the upper lip will be released and your gums won't be shown as much. Clients often ask me what have I done in terms of skin treatments and aesthetic treatments. So I often and regularly have Botox done to my forehead, the glabella and the crow's feet, and I also had hyaluronic acid derma fillers under my eye. And this is because I've been suffering of dark circles, and I was waking up in the morning after a good sleep and my body wasn't telling what my mind was feeling. So I looked in the mirror and I felt really, really dull, and actually I was happy. So I had derma fillers done, very small amount, 0.3 on each lower lid, on the tear troughs, and that changed my life.